Wellness Way affiliate right here coming out of Yorkville, Illinois. Happy Tuesday at noon, and welcome to our lunchtime question and answer. So thanks, guys, first and foremost, for submitting so many awesome questions. I love the questions. I love the interaction. Thank you so much for doing that. I picked a couple of questions that I want to answer. And then hopefully we got some time if some other questions come up that we can answer those questions as well. So somebody asked me, hey, why are you doing a Tuesday question and answer? And it's pretty simple. I have a little bit extra time during this, I don't know what you want to call it, quarantine, lockdown, depending on how you look at it. So with that extra time, I want to spend it with you. And I want to make sure that we're adding value to you. April is giving month. And so we have given so much back to our patients. Thank you so much for allowing us to be able to do that. Over the last couple of weeks, we've given away hundreds and hundreds of dollars of resources to people just for being part of our page, being a part of our Exemplify Healthy Families community. If you're not part of that, just go ahead and search. And it's on the first post. You'll see a link on this page that you can go ahead and join our Exemplify Healthy Families. So thank you so much for being a part of that, okay? And thank you so much for submitting some really, really awesome questions, all right? So let's go over some of these questions, and then, like I said, if we have a little bit of extra time, if we see some more questions pop up, make sure that you answer that. And if I don't get a chance to, we'll try to answer that by responding via comment, all right? So let me go over one of the best questions. One of the best questions that people gave, that people submitted, and it was submitted a couple of times. And this is really important, especially when it comes to COVID-19 and this whole idea behind testing and behind antibody testing. I'm going to go over that in just a second. So Kayla, how are you doing? Judy, it's great to see you. Good afternoon. So if it was 4 minutes before, you'd have to say good morning. So Judy, you also submitted an awesome question. I'm going to answer that in just a second. But let's go over this whole idea behind the antibody testing for COVID-19. All right. So this is what they're saying, well, we need to figure out before we release people back out into the public, we need to have some kind of antibody test in order to see if people have had the virus and if our people are actually immune to it. All right. Now, here's the problem with antibody testing is it's actually the wrong thinking, because people think if I have an antibody to a specific antigen, I'm going to have immunity to it. And that's actually not true. This whole idea behind having lifelong immunity to something, it actually doesn't happen, okay? So really when you look at antibodies actually say that you have had exposure to it. Let me give you a parallel, because when we do, for example, food allergy testing, so if we get like an IgG, IgE food allergy testing, and if it comes back that people might be responding to any kind of dairy, casein, or eggs of some sort, or some specific nightshade, or maybe wheat gluten, brewer's yeast, whatever it might be, what it actually means is it means that that food has actually gone through the barriers, the natural barriers of the gastrointestinal system, has presented itself beyond that barrier, and that now specific white blood cells have actually taken that, presented that, and that these B lymphocytes are now producing antibodies to it. And when there's an antibody response, basically that the whole idea of that antibody is it tries to inactivate that specific food before it can cause a problem, but it also demands an immune system response from it, okay? So this whole idea behind antibodies equals immunity is not true. And in fact, when it comes to we need a vaccine, the problem with this is that vaccines, how they say you're immune to it, is actually by looking at the amount of antibodies. So when they do vaccine research, one of the things that they try to decide if it is a successful vaccine is not if you have immunity to it, it's actually if you have an antibody response, which basically means if you inject something straight into the blood, you of course are going to have an antibody response. But does it actually mean that you are immune to it? Well, I want to show you guys something, and this is going to blow you out of the water. All right. Now look at this right here. This actually comes out of Forbes. This was actually done a few days ago, because this was actually the World Health Organization's response to the United States when they said, well, we need to do antibody testing. We can't wait for a vaccine. We need to do antibody testing. Now listen, the World Health Organization actually says this, that antibodies may not make you immune, says the World Health Organization. Now, are they right? Absolutely. Because just because you have the presence of antibodies doesn't make you immune to a virus for the rest of your life, okay? Now, this is the problem with this, is because out of one side of their mouth, they say, wait a second, the presence of antibodies doesn't make you immune to it, but on the other side of the mouth, they say we need a vaccine in order to produce antibodies that will make you immune. So if you guys can see just how ridiculous this is, and if you guys are actually paying attention, you guys are listening to this, you guys are using your brains, you're going to actually come to the conclusion, well, none of this actually makes sense. So guys, the problem with today is that we have forgotten to think on our own. We're told what to learn, we're told how to learn it, we're told that if 4 + 4 = 8, it says, well, I don't like how you came up with that conclusion, even if it's the right answer. And so we are so scared to start thinking on our own. And if we start thinking differently, we start asking questions, we're called conspiracy theorists. And so that is a form of what is known as gaslighting. If you've ever have heard of that, it's a very real phenomenon. So even the World Health Organization agrees. They say just because you have antibodies doesn't necessarily mean that you have immunity. Guys, let me tell you something. Let me show you something, okay? So I want you to talk, when you talk about certain viral infections, let's look at chickenpox, for example. When you look at chickenpox, if you get chickenpox, and you are supposed to have it through natural exposure, if you get chickenpox and you develop the pox all over your skin, develop itchy skin, rash, you might have a fever, sore throat, you might have all those symptoms of the immune system trying to handle the virus, and then it goes away. So yes, your body is going to be producing antibodies in order to handle that viral infection later on down the road, but that virus actually stays within your body for the rest of your life. And here's the reason why, is because what do they recommend for people over 60, 65 years of age? What do they recommend that they get every single year? Not only do they recommend to get a flu shot, but they actually recommend that you get a shingles vaccine. Well, the shingles vaccine, or shingles, is actually the chickenpox virus. So when does the shingles actually come out? When does it present itself? It presents itself when your immune system gets low. Now, there's a lot of different reasons why the immune system is actually going to get low. But when the immune system gets low, the immune system gets bogged down, then you have this virus that begins to grow inside of the body. If that makes sense. So what do you think the answer to any kind of viral infection is? Is that once you have had exposure, your immune system has handled it, you need to keep your immune system strong for the rest of your life. For the rest of your life. So it isn't about trying to avoid or trying to hide or trying to distance yourself from any kind of virus. The goal is build up your body, build up your immune system to the point where it's sufficient so that you can handle any virus that's out there. Now, here's what they're actually saying. When they're doing the antibody testing, they're actually finding out that there is way more people that have been exposed to this virus than they thought. And now they're actually projecting that actually the number of deaths that have come from this virus is about 1 in 1,000, which is right on par for the flu. And what it also means is that 1 in 1,000, how weak were their immune system to where a virus that the immune system should easily be able to handle, why weren't they able to handle it? which is why we should be working with those people and teach them on how to have a stronger immune system. And there's a lot of different things that you can do that can cause a lowered immune system response. What's your blood sugar at? What do you have? Type 2 diabetes? What are your stress levels at? How's your digestive system working? There's a million different things that you can do in order that can cause that immune system to start to break down, to wear down, and not have sufficiency. So what's the deal with this? Yes, it can mean that you have exposure, but doesn't necessarily mean immunity. No, because you're not immune. You don't have immunity from things for the rest of your life. And that's why one of the things with your immune system is that you should be exposing your immune system to as many things as possible, which I know that some doctors have actually said in written books that they call it, you should be eating dirt early and you should be eating dirt often. All right. We have to stop fearing viruses. We have to stop fearing bacteria. I want you to think about it. The only reason why we have soil is because of bacteria. Bacteria are designed to break down things. Funguses are designed to break down things in order to return them to the soil so that we can continue to grow food. That is what the purpose of bacteria, virus, or fungus. They're not there to hurt us. They're there to help us. They only hurt us when we can't fight those things off. They are opportunistic. So hopefully, guys, that makes sense for you. So Amber, how you doing? Robin, thanks for joining us. Mitzi, thanks for joining us. Roxanne, Thermanda, Judy, hi again. Carrie, Brenda, Christina, Kristen, how you guys doing? So what is the deal with this? Is that we should be working on having a healthy immune system. So I know that Judy had a question too. She said, why is apple cider vinegar good for my skin? Okay. Why is apple cider vinegar good for my skin? Well, listen, when you look at the purpose of barriers inside of your body and outside of your body, it's actually there to keep things out. So the skin is actually part of our immune system. The skin provides a barrier that doesn't allow bacteria, viruses, and things like that to get in. In fact, really, if you look at your skin, and if I would do this, I just sloughed off billions and billions of bacteria off of my skin. So, and in fact, what I've also sloughed off by doing that is Staphylococcus aureus. So when people say, oh my gosh, I have a staph infection, guys, staph is normal flora that lives on your skin. Strep is normal flora that lives in your gastrointestinal system. They're just normal. So if you have an infection, it's not that that bacteria attacked you, it's because you don't have a sufficient immune system response, or you've had a breakdown in the barriers, and all those bacteria, all they've done is they're opportunistic. They grow when the immune system goes down or when the environment to keep them suppressed is not ideal. So what's the deal with apple cider vinegar? Okay, so is it good for your skin? Absolutely. And the reason why is actually, guys, if you look at your skin, you have multiple layers of skin that helps to protect you from your external environment and your internal environment. And in fact, on your skin should be slightly acidic. So it should have a pH level of about 5 or so. And so what is apple cider? How does that help? Apple cider vinegar is very acidic. And so it will help to make the skin more acidic, because when you look at opportunistic bacteria, like staph, for example, opportunistic bacteria actually thrive when the acidity gets to be around more 7 or more pH balance. So putting apple cider vinegar on your skin can provide more acidity and more protection to your skin. Okay, there's some benefits as well with apple cider vinegar, but apple cider vinegar also is great for the digestive system. So it's great in order to stimulate digestion and also to stimulate stomach acid as well. So Judy, thanks for that question. Someone else asked the question. They said, how do pain medications affect my digestive system? So I want to show you one thing. This actually comes from WebMD, guys. And I think if you guys can learn how to research, if you guys can learn how to start to find things on your own and also be able to decipher, is this good information or is this not good information? I want to show you this one right here, okay? So Which medicines cause stomach pain? Now, this is coming from WebMD, all right? If you do any kind of health Google search, probably WebMD is going to come up first. So if you guys don't know, Google does suppress search engine results for anything that is natural. So even if you go and you search out an herb like astragalus, for example, the first thing that's going to come up is going to be WebMD, and it's going to say something negative and something bad about it in order to sway your opinion. Their whole goal is to say more drugs, more testing, less things natural, less things nutrition, less things to help you get well on your own. So this comes from WebMD. They say, what medicines can cause stomach pains? Over-the-counter painkillers, aspirin. So aspirin, for example, can affect the lining of your stomach and cause belly pain or other problems. Other pain relievers like ibuprofen or naproxen can lead to heartburn, irritation, and other stomach trouble too. If that happens, now watch, if that happens, try taking these with food or with a drug that treats heartburn. Is that not crazy? They say if you're taking aspirin, rather than say, why don't you figure out why you need to be on aspirin? No, they say continue taking the aspirin, continue taking the naproxen, continue taking the Advil, but just take it with some heartburn medication. So here's the thing with over-the-counter medication. Aspirin, for example, will wear a hole in your stomach. So it will cause an ulcer. And when you start having an ulcer, you are going to have a bad, bad day. And the reason why is that when you have an ulcer and you eat, which requires stomach acid in order to start breaking down the food, mixing the food, and sterilizing the food from any kind of bacteria that's coming in, then what happens is anytime you secrete that acid, it's like pouring hydrogen peroxide on an open wound, and it's going to hurt. So even common over-the-counter medications will absolutely destroy your gastrointestinal system. They're going to mess with stomach acid, guys. And when you mess with stomach acid, it is like the first thing to cause all kinds of problems within your gastrointestinal system. So you can't sterilize the food. If you don't have proper stomach acid, you run the risk of having more infections downstream within the gastrointestinal system. Things like yeast, things like parasites, things like bacterial overgrowth. So those things, those bacteria that are living within you have an opportunity to thrive, especially when you don't have an acidic environment within the gastrointestinal system. Same thing with antibiotics. So antibiotics are going to kill the whole microbiome. They'll kill the bad, but they'll also kill the good. And many times what happens is you'll start to get an overgrowth of other bacteria or yeast or things like that within the gastrointestinal system. Cholesterol drugs, which can cause heart problems. Your doctor might recommend a medicine to bring cholesterol down. Some of these can affect your digestion and cause problems like gas, constipation, or diarrhea. Okay, so what do? Start taking more medications for it. What about opioid pain medication? So oxycodone, hydrocodone can make you feel nauseous or give you constipation, belly cramps, or bloating because it messes with the gastrointestinal system. But the thing is, guys, if you've seen, it's on commercials now, they actually have medications for opioid-induced constipation, if you can imagine that. Why not just try to figure out why your body is so inflamed in the first place? So what do? How do you start doing that? The first thing is figure out why the body is so inflamed, why you would need to be on any kind of pain medication in the first place. And guys, I'm going to tell you, there's so many different areas where someone can have chronic pain. I actually just got off the phone doing a consultation with a woman who just broke my heart because she's 33 years of age. She has autoimmune markers, chronic pain. She literally can't pick up her daughter. She wants to get pregnant, but she's scared to death because of the amount of pain that she's in. Doctors say you have an autoimmune condition. Some doctors are saying that she has fibromyalgia. And then I kept digging further and further and further. And she said, oh yeah, I've also had my gallbladder out. And I said, when did your health start to take a turn for the worse? And she said, it was very shortly after I had my gallbladder out. Because guys, when you have your gallbladder out, you immediately stop breaking down your foods, your fats, absorbing minerals, absorbing vitamin D, and you start to have a bad day. Guys, when you have a gallbladder issue, It's not a gallbladder issue. It's a liver issue, which is why so many women have problems when they have a gallbladder issue. They have such a hard time with fat metabolism. They have such a hard time with their estrogen metabolism because it all comes back to the liver. It's the liver, guys. So you got to figure out why you're on pain medications in the first place. So here is another one. Let's see if we can bring up this next one. So how do you, let's see if we can bring this up. All right, so how do you establish, let's see if we can bring this up. All right, it's not coming up. How do you establish healthy digestive barriers, okay? So guys, I'm gonna say one of the most important things is for your immune system is to establish healthy barriers. Healthy barriers with your skin, healthy stomach acid, proper enzymes in order to break down food, having healthy bile stimulation, but also downstream, how do you establish healthy barriers? Healthy barriers is basically how do you establish a nice mucus layer within your small intestine, large intestine, and that's actually where your microbiome lives, okay? So I want you to think about it. Everyone takes probiotics, but everybody who takes probiotics actually does things to destroy their microbiome, okay? So they're using hand sanitizer. They're taking antibiotics. They're eating foods that damage the intestinal lining, like wheat gluten, for example. They're eating multiple different food allergies that's damaging the intestinal lining. They're eating things that damage the intestinal lining, things like glyphosate, which is basically Roundup. Guys, if you look at around here in Illinois, we have some of the largest Roundup concentrations than anywhere else on the entire world. And so glyphosate is known to damage the gastrointestinal lining. So first thing, how do you establish healthy barriers, digestive system barriers, is you have to stop destroying it, okay? So the thing is that do probiotics work? Yes, but you need something for them to grow in. So having a healthy microbiome really is determined by having a healthy mucus layer. Every bacteria loves to live in a dark, moist, warm mucus environment. So if you can't produce that mucus layer, then any kind of probiotics that you're taking is not going to work. So in order to develop that, you need to properly acidify the gastrointestinal system. You need to make sure that you're breaking down your foods the way that you're supposed to. And you also need to make sure you're not doing the things to break that down. However, there are some things that we give people starting off to help reestablish that nice mucus layer. Does anybody know what helps those cells within the intestines to secrete more mucus? Does anybody know there's a specific herb that will help with that? Okay, a specific herb. Does anybody know what the herb actually is? It's probably nothing of what you thought it would be. It is chamomile. So chamomile is actually the herb that will help with goblet cell secretion so that it can help to make a nice, healthy mucus layer where that microbiome will actually will start to grow. So that's one of the things. But I'm going to tell you guys, the first thing is always make sure that you're not destroying the barriers with some of the things that you're doing. Because if you keep doing those things, it doesn't matter how much chamomile you take. It doesn't matter how much probiotics that you take. They're never, ever going to be able to establish if you're not doing some of those other things as well. So great question. Let's go to the next one, and then we'll take some time for a couple of other questions, all right? So someone asked, they said, Dr. Nate, I'm on a limited budget. Where do I start? So I'm on a limited budget. Where do I start in my wellness way journey? It's a great question, but where do you start determines primarily on what are some of the biggest things that are driving down that whole entire Swiss watch. When we talk about the Swiss watch, we talk about how every single body system affects the others. So a lot of times what it could be is let's say someone has a lot of chronic pain. They have a lot of chronic pain. The first place that I would start is probably make sure that you're getting x-rays, start with chiropractic, and then probably at least start, if you can't afford food allergy testing, is just start on a non-inflammatory diet. So start avoiding some of the big ones like dairy, start avoiding like milk, cheese, start avoiding corn, start avoiding soy, start avoiding wheat, start avoiding some of those big ones that almost everyone has some sort of inflammatory response to. And that will start to lower your inflammatory levels inside the body, and then see where you go from there. So do you have to start by taking tons of supplements? Guys, the whole idea of a supplement is just to buy you some time until we start figuring out some of the biggest lifestyle things that you're doing that is causing that whole Swiss watch principle to start to grind down to a halt. So chiropractically, do we see people a lot starting off? Yeah, for some people, but ultimately we're saying this, our job, if we're truly being a doctor, is for you not to need us as much. So this is why we do home exercises on every single person, so that we're trying to lower the need for them on us. In addition to that, this is why we sit down with food consultations. We teach them how to shop. We teach them the types of foods they should be eating. And so that we are giving you the power to be able to eat things and have the power over your lifestyle, so that you don't continue to get sick. This is why we teach exercise. We tell people, hey guys, in order for you to correct some things, you're going to have to start exercising. But exercise, guys, at the end of the day is free. Eating the right foods is free. Doing your home exercises is 100% free. So ultimately, you guys should be the ones in charge of your lifestyle. And who we are as Wellness Way doctors is we're just the tour guide. We're just showing you the way. Now, do you need our help a little bit more starting off? Absolutely. But nothing makes me happier than watching a person have the ability to take care of themselves and then have the ability to stay well, because they know how to change their lifestyle and they know how to maintain their health for many years to come. So I would start obviously with chiropractic and non-inflammatory diet, and then maybe do some things in order to help with the digestive system. So things like some apple cider vinegar, again, avoiding gluten, avoiding corn, dairy, soy, and even for some people, having them avoid some eggs can also help with that as well. All right. So let's take a couple of questions. If you guys are enjoying this, if you guys have found value with this, do me a favor and please share, and let other people know about this as well. So let's create a great community of people getting well together. So what causes a burning sensation in the stomach above the belly button? Okay. So a burning sensation, Courtney, above the belly button, tough to say, but it depends on when you're getting some of the burning. Okay. So you may have some problems with stomach acid. It may be some problems with acid reflux, maybe a problem. You may have an ulcer either in the stomach or a little bit further down in the duodenum. However, I've also seen that some people too who have what's known as a hiatal hernia can have some burning in through the stomach. And so what a hiatal hernia is if you have a weakness in your diaphragm. And that diaphragm is basically a big dome muscle and sits right above the lungs. And as it contracts, it will cause the lungs to expel air, and then it relaxes and allows the lungs to actually fill back up. Sometimes if you get a weakness, the esophagus goes through there, that forms, and the stomach goes underneath the diaphragm. Sometimes if there's some kind of weakness through there, the stomach can poke through that little hole where the esophagus goes through, and that can cause some problems that can be similar to acid reflux. So in fact, we just did this on a guy who was having a lot of burning, and he's got a hernia, a diaphragmatic hernia. And so all we do is we push that back, try to push that back down, back underneath the underneath the diaphragm. It doesn't feel very good when you do it, but it helps. We've helped so many people, obviously, with that. All right. All right. So will chronic pain eventually go away? Like if we're taking supplements, avoiding allergies, and getting regular adjustments? Yeah. Will chronic pain go away? Yes. And this depends on who you're working with, Courtney, because again, initially especially in my opinion, initially what we're doing is we're trying to do this. We're trying to help you not keep picking at the scab. So the first thing is we got to help you to not pick at the scab so that it keeps inflaming. Give some things in order to calm and settle down inflammation. But ultimately what you have to do is you have to make sure that you're getting to the underlying cause as far as what that is. But I want you to think about something. We talk about how to rebuild, repair, and help tissue to be able to regenerate and repair, is you got to think of it no different than if you would break a bone. So if you broke a bone, you broke your arm, for example, it can take anywhere from 8 to 12 weeks in order for the body to start to heal that fracture. So that is, you have sufficiency where you don't need to have a cast anymore. But in reality, it can take a year for that bone to remodel itself to be as strong or stronger than it was prior to the break. So the problem is so many people, when it comes to healing, is that their time frame is way too short. And the reason why is because drugs are always more powerful and will produce an effect much sooner than changing your lifestyle or by supplementing. Drugs are always going to be the most powerful and the most dangerous, but you will see is if you can manipulate certain things, it happens a lot quicker when it comes to controlling symptoms and things like that. Okay. So Christina asks, yes, but can HCl cause ulcers too? Hydrochloric acid never causes an ulcer. So one of the reasons why you can get an ulcer within the stomach is actually not having enough stomach acid. So one of the things is that you have a specific bacteria called H. pylori, and it lives at the bottom part of the stomach, right where the bottom part of the stomach meets the duodenum. So there is a ring sphincter there. And basically that H. pylori hang out right there, and it's just normal flora. It will always hang out there and not crawl back into the stomach if you have sufficient stomach acid. So as that stomach acid starts to go down, that bacteria is now opportunistic, and it can start to live within the higher pH of the stomach. Now the problem is when you have an ulcer, then you do secrete a little bit of acid when you eat. It hurts. So sometimes though, when we can't give people some hydrochloric acid in order to increase the stomach acid because it burns so much and it hurts so much. At that point, typically what we do is we tell people to fast for 2 or 3 days, tell them to drink a lot of aloe juice to help coat the stomach. And then that stomach, the stomach lining turns over very quickly. And so that's why healing from an ulcer really only takes not that long, and as little as about 48 hours that an ulcer can actually heal, because being in that very high acidic environment, that stomach tissue has a very, very high turnover rate. But that's a great question, right? All right. So Kayla says, yes, my issues started shortly after getting my gallbladder out, now that I think of it. So guys, if you know anyone who's gotten their gallbladder out, I'm going to tell you something. They are very sick, and just ask them, when did all of these issues start to happen? And they will tell you not very long after you've gotten your gallbladder out. So this woman that I was talking to earlier, only 33 years of age with terrible, terrible pain. And I asked her, I said, since you don't have a gallbladder, did your doctor tell you that you needed to be on some kind of gallbladder replacement and or some kind of digestive enzyme, since you're not going to be able to absorb fats the way that you're supposed to? And she said, I never did. So you're going to see that then these people are going to have a lot of hormone issues. You're going to see that these people are going to have a lot of problems with fatty stools. You're going to see that they probably have a lot of dry skin. And the reason why you're going to see that they have a lack of vitamin D absorption, for example. And this is why it just continues to cause a cascade of all these other problems, especially down the road. All right. All right, maybe a couple more questions. When we have our gallbladder, what is the only supplement we need? So when we have our gallbladder, so hey, if you have your gallbladder, thank God that you do. Doesn't necessarily mean that the gallbladder could be working the way that it's supposed to. Christina, usually if you do a food test and you start seeing the presence of a lot of high fatty food when you're doing a food allergy test, that is one thing that can tell you that the gallbladder is not working the way that it's supposed to. So some things that can help can be digestive enzymes. Dandelion root also can help with that as well. I wouldn't necessarily recommend ox bile, but I would look at a food test or maybe a stool test too to see how much fat is in the stool. But usually dandelion root can suffice. And sometimes just digestive enzyme, pancreatic enzymes that contain lipase can help as well. So that's a great question. All right, so hey Christina, if he prescribed HCl, if you get the burning, because it's happened to me too, is that people we've prescribed hydrochloric acid, if you know that it burns and it burns right away, then what we do is we just basically, for me anyway, I assume that there is an H. pylori infection that's going on. So rather than test for it, we're just going to assume that it is. And in that way, it just says, hey, we're going to lay off of this for a while. You may need to fast, and you may need to drink some allergy juice and stuff in order to help coat that stomach while that heals. That's a great question. All right, so great questions, guys. Lori asks, how do you tell if you have a problem with ulcers, acid reflux, or heartburn? Well, chances are is you're probably going to know if you're having acid reflux or heartburn. Okay, so if you have the diagnosis for having heartburn is that you feel burning in the stomach or above. Okay, and one of the reasons why you start to feel the burning sensation is when you don't produce enough stomach acid. And remember, the purpose of the stomach acid is to mix the food, but primarily to sterilize the food. As it starts to get mixed and turned with that acid in order to get broken down, as it goes to the sphincter at the end of the stomach going into the duodenum, there's literally like a neurological sensor there that says, has this been mixed enough? Has this been sterilized enough? And if it hasn't, that sphincter will quickly close and it will propulse the food back into the stomach to go through mixing again. Now, the thing is, you also have another sphincter between your esophagus and your stomach that is actually open. And when it tries to go to mix that food, you can get some high acid type, we call it chyme, and it can go and then get into the esophagus. And that's what will start to erode the tissue. If you've ever heard of Barrett's esophagus, in which you have eroded tissue within the esophagus, and that can actually long-term can cause those cells within the esophagus to turn cancerous. This is how you develop esophageal cancer. So how to know how well you're breaking things down and whether your stomach is acidic enough, even before you're having symptoms, is that you get a food test. And a food test will actually see if the stomach is acidic enough, because if you have the presence of a lot of protein antibodies on a food test, then what happens is it means that the stomach doesn't have enough stomach acid in order to start breaking down those foods or those proteins into its smallest constituents, which are amino acids. So remember this, proteins don't belong in the blood, but amino acids do. And all proteins are chains of amino acids, and amino acids are basically proteins broken down into its smallest molecular form. All right. Kayla asks, how long does dairy stay in your system after cutting it out? We just cut it out last week and wondering if it'll help my son's behavior issues once it's out of the system. Well, here's the thing, is that dairy, that stuff can get out of your system fairly quickly. And I'm going to say this, and this is my opinion off the top of my head, but about 2 weeks. So the dairy is not necessarily what's causing the problem. It's actually the inflammatory reaction to the dairy that's causing a lot of the symptoms. And the inflammatory reaction is actually a good thing. It's good. And so when it comes to acute inflammation can last anywhere from 3 days up to 14 days. So you have to think of it give me a thumbs up if any of you have ever had an acute low back episode. And people come in and they're literally like have never experienced more pain. If you've ever had an acute low back, it is some of the most pain that you could go through, at least for me as a guy, because I've never given birth. I've heard kidney stones or even worse. But when people come in and they have this acute low back, here's what I tell them. I say, no matter what I do for today, you're still going to hurt. And the only purpose of me to adjust you is just to start getting things moving again so that it will heal properly. And so even if we get it to start to move a little bit, start to move that area and get it to move properly, you still have to go through an acute inflammatory reaction in order to heal that area. And so this is why when I tell people, 7 days later, I said, I'm imagining you probably are feeling like you turned a corner. And they say, yeah, how did you know? Because we just understand what acute inflammation actually is. So Kayla, just give that about 14 days in order to see by avoiding it and to see, how that inflammatory reaction starts to clear out. Okay. Great questions, guys. Great questions. All right. Felicia, I lost my appendix and gallbladder a year later. I was diagnosed with, so I have not had anything with acid to do. So what can you do? Okay. So again, there's a purpose for your appendix. So every organ inside the body is needed. When they say we don't think that you need your appendix, they're just saying we don't know why you need it yet. And so there's a lot of debate as the purpose of the appendix, but I actually read that with the appendix, when someone is undergoing an infection, it's actually that appendix is almost a storage tank for the healthy microbiome to live in during that infection. So there's got to be a reason why you have an appendix. Do some people need to get it out? Yes, in order to avoid that appendix rupturing and causing a systemic infection everywhere inside of the body. So absolutely. All right. So the thing is I had anything. So I'm not sure, Felicia, what IC is, but you're going to notice that a lot of women who have their gallbladder out down the road, they also are having hysterectomies again, because even with the production of bile within the liver, those same different pathways are needed for healthy estrogen metabolism. Okay. So all great questions. Judy says, just went through low back pain. Awful, right? It's awful. And a lot of times when people are going through a low back incident, I've been through it before. I've had a lot of low back incidents, not as many as I did 4 or 5 years ago. There's a reason why, but going through it is absolutely horrible. And it's just, you have to go through acute inflammation and you have to honor the body as much as you can physically tolerate, because the more that you can do that without suppressing it with medications and things like that, the better you're going to be, obviously in the long run. All right. So guys, awesome. I know we spent a lot of time going over your questions, but again, I appreciate the questions. I'm happy to answer them for you. Just do me a favor and just make sure that you like this, make sure that you share this, and tell other people. And just for those people who are sharing this, who are part of our Exemplify Healthy Families page, if you guys are sharing this, we notice that you're sharing, because coming up on Friday within our Exemplify Healthy Families page, we are giving away an Wellness Way immune system panel. So this is actually what we should be testing people. Instead of testing for COVID-19 antibodies, we should be doing a Wellness Way immune system panel to see if people have immune system sufficiency to the virus, to the COVID-19, to any kind of infection going on, because when the immune system is healthy, you can handle a virus, you can handle a bacteria, and your immune system is stronger for it. All right. Now, like I said, make sure you like, make sure that you share. And then one other announcement coming up, if you're not part of the Wellness Way Challenge group, coming up in May is going to be No Sugar May. No Sugar May. So if you're interested in participating in No Sugar May, make sure you join the Wellness Way. I'll type it in here for you. The Wellness Way, you can search for it. And then ask to join. And coming up in May, like I said, no sugar in May. So it is always a fun experience to go through no sugar for a whole entire month. All right. All right. Awesome, guys. Well, I appreciate all of your questions. And again, if you got any more questions that you want me to answer, possibly for next week, just type them in the comments below. I appreciate it. And you guys have a blessed Tuesday afternoon. Enjoy the wonderful weather if you're from around the Yorkville area. And again, make sure that you make sure that you share. Guys, be well. We'll see you soon.